Hello, good morning or good afternoon, wherever you are. Nice to see you. Hello, hello. My name is Jo. Welcome to today's live session. How are you? Can everybody let me know where you are in the world? And does anyone have their OET coming up in the next couple of weeks? I'd love to hear from you in the comments. Do let me know. Good morning. Hi, Esther. Hi, Nixon. Nice to see you. Great. And let me know if you are a doctor or a nurse or even one of the other professions, if it's a pharmacist as well. Okay, great. So, Grace from Nigeria. Hi. Priya from Saudi. Great. Theophilus from Ghana. Great. We've got people from all over the world. Wow, that's always nice to hear. So, today we are going to take a look at giving clear explanations. Okay. But before we begin, I just want to tell you a little bit about some of our courses we've got available for you that could help you with your OET preparation. So specialist language courses .com is our website. Do go and check us out. We now have subscription packages on all courses, and they're available on all devices, so mobile, tablet, computer, so you can study whenever you want, wherever you want. Okay, so do go and check us out on our website. We've got lots of different things that can help you pass your OET exam. We've got Reach OET-B, which is our OET preparation course, which you can do in combination with a teacher, or you can do it as a self-study package. So here we are, we've got on the screen Reach OET-B Nursing. We've also got the medicine version as well. So it's 100 hours of preparation. You also have 4 live lessons with a teacher each week, Monday, Tuesday, Wednesday, Thursday. There are 3 full OET nursing and medicine practice tests. You've got tutorial videos, writing correction letters, and the SLC Progress Promise, which means that you can attend the live lessons until you pass your exam. Okay, so you will always have contact with a teacher until you pass your exam. So do go and check us out. On the screen, we've got a QR code. So do scan. That will take you to our subscription courses now. So go and check us out. Also, if you're not already subscribed to our YouTube channel, please do. We've got loads of videos to help you on your journey to OET success. We've got a new series of videos coming up. Actually, that's launching today. So please do go to our YouTube channel and subscribe. Okay, so we're starting off today with my top five free OET resources. We also do a Q&A the last Wednesday of every month at 12 p.m. UK time. Come and you can ask me questions about anything OET. So again, this is on YouTube. If you go to our YouTube channel, you'll get notifications about when the next one's coming up. So today we're going to look at features of clear explanation. So we know what a good one looks like, and we'll look at how to provide a clear explanation and some useful language. And of course, I'll give you some study tips to help you practice. So I would like to know in the chat, please let me know, what should you do in order to provide a clear explanation? What are the features of a good clear explanation? Let me know in the chat, please. Okay. All right, some great ideas coming up here. Brief in order, checking for understanding. Yes, absolutely. Okay, listening. Yes, that's a good idea. Yeah. So you need to listen to your patient so you give them the right information. Absolutely. Yes. Straight to the point. Yes, Grace. Okay, some wonderful ideas. Let's go through a few now. So, for a clear explanation, you need to find out what they know, confirm or correct. It's confirm or correct the information. Use patient friendly language that they'll understand. Split the information into manageable chunks. Use linkers and signposting language. Pause to allow the patient to respond. Elicit and respond to any concerns as appropriate. And of course, check understanding or that they agree to follow your advice if it's an advice one. This will ensure that you're getting high marks in providing structure and information giving. And this is what we want. We want high scores so we can pass our OET. So, if we look at a role play task, imagine you've been given the task. You're speaking to the mother of a child who's recently been diagnosed with eczema. Let me know in the comments, please, what tasks could you be asked to perform during the role play? So, what would some of those tasks be? Okay, some ideas coming through. Reassure the mother. Yeah, absolutely. There could be things like that. Yeah, the mother could be worried, for example. Okay, so we've got here use of moisturizers. Yeah, so it could be explain the treatment or how to manage it with moisturizers, for example, and things like that. The reason, yeah, so causes. Great. And all of that is explaining. Okay, so here are a few ideas. We could have explain what eczema is, explain symptoms, reassure the mother that it's a common condition. So, explain is one of the most common tasks that come up on the OET role plays. So, it's really important that you know how to do this effectively. So, have a look on the screen now. Which explanation, one, two, or three, is more effective for an OET role play, do you think? Let me know in the comments. One, two, or three. Which one is more effective? Okay. Everybody seems to be putting the same number. Excuse me. Lots of threes coming through. Let's have a look. And three is the better one. Yeah. So it's very clear, um, connected. It's not too technical. For example, number one, inflammation of the outer epidermis. I mean, just say skin. It's easier. There's no checking there. Okay. And in number two, there's no linking. It's three very short sentences. So it doesn't flow very well. So, um, in order to get to reach all the criteria for information giving, you need to find out what a patient already knows. This is one of the indicators of information giving. So here it is, establishing what the patient already knows. So, which phrase could you say at the beginning of an explanation of jaundice to find out what they already know? One, two, or three? Let me know in the chat. Okay, great. Yes, I mean the other two, yeah, great. Most of you are saying one, which is good. Most of you, you could also do number three as well. But I think do one first and then three. based on the information that they provide. Yeah. So you could say both phrases at the beginning of an explanation, but number one finds out what they know already so that the information you then go on to give is the right information, the information they need. Okay. If you go straight into the condition, um, you might be giving them information they already know, perhaps, or information that they don't want to know. So we'll take a look at that in a little bit more detail. So before proceeding with explanations, it's really important to find out what they know already. Okay, so things like, can you tell me what you know about cholesterol? Would you mind telling me what you know about diabetes? Okay, so as I said, the patient's response will give you the opportunity to respond in a variety of ways. So let's take a look at that now. So here we've asked the question, and then we've got, I've heard of it, but I don't really know what it is. So the patient knows nothing about the condition. So you signal that you're then going to explain. Okay, so let me explain a little bit about what jaundice is. Is that okay? However, it could go this way. Yes, isn't it when your skin goes yellow or something? So here the patient knows a little bit about the condition, so you confirm what they know is correct, or maybe incorrect if they get if they don't know, and then signal that you'll explain a bit more. So you might say something like, yes, that's right. Let me explain a little bit more about it. Is that okay? All right. So what you say really depends on how the patient responds. So starting an explanation. So important that you're using signposting phrases when you're starting an explanation once you've found out what they already know. So you can use things like, let me explain. I'd like to explain if that's okay. Now I'm going to explain. Okay, this signals to the listener that you're about to explain and it prepares them so that they're ready to receive the information. And once you've signaled that you're going to explain, you can then begin your explanation. Okay, so as we were discussing before, you need to keep it clear to not overwhelm the patient or carer. So use patient friendly language, so non technical terms wherever possible, and split your explanation into manageable chunks. And use linking expressions. Okay, so to connect the ideas together and make the information easy to follow. Use the rule of three. It's a good tip. So no more than three pieces of information in one chunk. So you can do chunking and checking. So you give them, it's a good idea to use a moisturizer every day, wear loose clothing, and avoid extreme temperatures. All right. Pause. If you've got more advice, you then continue with another three if necessary. Using pauses is also part of the criteria. It's really important that you use pauses effectively. So have a little listen to this explanation. I'm going to read it to you and tell me in the comments, what do you think? Okay, so I'm going to explain and show you how to use an inhaler, but first I'd like to talk about what causes asthma. Asthma is caused by an inflammation of the airways and it can be triggered by many things, for example, by environmental factors such as smoke, pollution, or cold air, or it could be exercise, or it might also be set off by colds or flu. And this means it's important to identify and then avoid your asthma triggers to keep your condition under control. So, the information's great, but the way I delivered it, not so great. Let me know in the comments. What was wrong with my explanation? Okay. Mm, absolutely. Great. Yes, Rajnis. Pauses are missing. Yeah. Yeah, yeah, difficult to understand. Yeah, why is it difficult to understand? The message is not clear. Yes, Grace, but why? Yeah, we're not pausing to let the patient express understanding or concern. Yeah, no checking of understanding. We have to pause to get the patient involved. Absolutely. Yes, Robin. Yeah. Uh-huh. Uh-huh. All really great ideas. Yeah. So the information's really useful as well, but it's not easy to follow. So let's have a look. Yeah, there's no pauses. Oh, speaking quite fast as well. There are no chunks. Yeah, I talked about, what it is, what it might be caused by, and how it might be treated or, avoiding the trigger. So that's quite a lot of information in one chunk. Okay. And then did not check previous knowledge. Yeah, I did not check previous knowledge. Absolutely. So what would be better is something like this. I'm going to explain and show you how to use an inhaler, but first I'd like to talk about what causes asthma. Is that all right? Yes, fine. Do you know anything about the causes of asthma? No, not really. Oh, so, asthma is caused by an inflammation of the airways and it can be triggered by many things. One common trigger is allergies or perhaps environmental factors such as smoke, pollution, or cold air. Another trigger could be exercise, or asthma might also be set off by colds or flu. All right. So, this means it's important to identify and then avoid your asthma triggers to keep the condition under control. All right. Do you have any questions about that? So, see, there's lots of pausing, there's lots of linking expressions and discourse markers which help connect the information together. So when I'm giving the information about the causes, I'm using things like one common trigger is, another trigger could be. Yeah. So we also need to check that the patient has understood. So after each chunk, you should pause and allow the patient to absorb the information and ask any questions or express any concerns. We need to check that they've understood. We could ask them just simply, okay, all right, is that okay? So if we have a look here, we've got that several times throughout the explanation that I just did there. Okay, so we call this chunking and checking, and it's a really effective way of delivering information. You also need to encourage the patient to respond and confirm that the patient agrees, understands, or agrees at the end of the explanation and find out if they require any further information. Yeah, so those are 3 points that actually are on the information giving criteria. Encourage them to respond or contribute reactions, check that they understand, find out if they require any further information. So you can do that by asking questions such as these. How do you feel about that? How does that sound? Do you think you'll be able to manage that? Do you have any questions about that? Would you like me to go over anything again? So at the end of your explanation, it's a good idea to ask one of those questions depending on what you've given. So let's look at it in context. We'll do a bit of practice together. So let's just recap the steps in explaining a procedure or medical condition. So step one, find out what they know, signpost you're going to explain using linkers, the rule of three, and then pause and confirm and encourage the patient to respond. So we're going to look at it in the context of explaining advice on managing eczema. So not explaining eczema, explaining how to manage eczema. So number one, what could you put in this space here? The patient says, I don't really have any idea, but I'm a bit worried. What phrase could you do for number one? Let me know your ideas in the comments, please. Okay. Mhm. Are you familiar with the word asthma? Remember, we're finding out what they know about managing eczema. So, are you familiar with how to manage eczema? Would perhaps be a little bit better. Do you have any knowledge about how to manage eczema? So, this is after you've already explained what asthma is. Okay. Uh-huh. But yeah, all really good phrases to use. Do you have any knowledge about? Are you familiar with? Yes, things like that. Uh-huh. So we could say something like this. Could you tell me what you know about managing eczema? So the patient says, I don't really have any idea and I'm a bit worried. So, bit of empathy. That's completely understandable. And then number two, so now we need to signpost that we're going to explain. So, what could we say for number two? Let me know in the comments, please. Okay, great. So, yeah, something signaling that you're going to explain. Yeah, I will explain it to you. Something like that. Let me explain. Yeah. So, here's an example. Let me explain how you can look after your son's skin at home. And the patient says, or the carer, okay, thanks. So, now we need to explain. Okay, so I've just got that here. Firstly, it's really important to keep his skin moisturized. One thing which might help is making sure he is not too hot and not too cold. Also, it's a good idea to dress him in loose clothing so that the skin can breathe. So, we've explained using linkers and the rule of three. We've got firstly one thing also. So, what can we say at the end for step four? Pause and confirm or encourage the patient to respond. What could we say for number three? Let me know in the comments. Okay, so yeah, yeah, yeah. We want to find out if they understand that or if they'll be able to manage that. Absolutely. So yeah, we could ask if they had any questions about it or if they'll be able to do that, something like that. Great. All right. So here is one possible option. Do you think you can manage that? Yeah. Rather than asking, am I clear? Which just gets them to say yes. Okay, it's better to ask them perhaps if they'll manage that. Do you have any questions about that? You want to encourage them to speak. And here, you know, we're giving them advice on something to do, action to do. So we want to check that they'll be able to manage that. Okay. So that's how it would look in an OET role play, and that would get really good scores for providing structure and information giving. Yeah, because it would be sequencing it logically, signposting changes in topic, using organizational techniques. We found out what they already know. We're pausing, we're encouraging them to respond, and we're checking whether the patient has understood information. Yes, and we might, after they say, yes, I can do that, discover what further info, do you have any more questions or concerns? Something like that. So, one thing to be careful of is making sure you're giving the right information. Don't overcomplicate it by coming up with your own ideas. Use the information provided on the roll card. Okay, so for example, here we've got a pre anesthesia evaluation. It says explain the anesthesia procedure, and you've got some information in brackets. Yeah, and you've got other information here. Use that information. Okay, plan how you're going to say it in the preparation time. Here's ones for nursing. Again, bruised, swollen, movement restricted. Use that information. Okay? Use the information on the roll card. In terms of practicing, you can use OET roll cards. You don't have to do the whole role play to practice explanations, or you can just use different medical topics. Go to the NHS website, look up common conditions, and practice. So here are a few ideas on the screen. You could go how to change a simple dressing at home, and then you've got some ideas in brackets. You can explain what happens in dialysis, or explain what newborn jaundice is. So when we finish this live and it's published, go back, look at this slide, or take a photo of it now, and why don't you practice today? Record yourself, listen. How effective were you? Yeah, go back and look at the video with it and use, the features of a clear explanation as a checklist. What did you do well? What could be improved? Then repeat. Okay, so just to recap my top tips for clear explanations: ensure you ask the patient first what they know about a condition or how to manage a condition. Deliver the explanations in chunks with pauses in between. Keep encouraging them to respond and check that they understand. So, chunking and checking. Okay. If you have any questions, I've got a quick couple of minutes. You can pop them in the comments. Any questions about what we've talked about today, giving clear explanations. Remember, we've got subscription packages available. You can subscribe to our courses for 1 month or 3 months. There's also one-to-one classes available. So check out our website, specialistlanguagecourses.com. It's on the screen now. Or why don't you scan our QR code that's on the screen now? That will take you to our site and you can have a look at our courses now. Subscribe today for success. Okay, so do check out our website and follow us on social media. We're on all the social media platforms: TikTok, YouTube, LinkedIn, things like that. So do go and check us out. Remember, YouTube is OET SLC, okay? For TikTok and Instagram, it's SLC OET, okay? All right. Well, are there any questions? Haven't got any at the moment. Okay, but if you watch our videos and drop us a question on our YouTube channel, we always try to respond to them. So we're here for you. Do let us know if you have any queries. All right. Well, that's it from me today. So I hope you found that session useful. And I will be here, I believe it's next Wednesday. I'll be here on YouTube 12 p.m. UK time for my OET Q&A session. So I hope to see some of you there. We'll be live on Facebook and YouTube on the SLC pages. So do subscribe to those and check us out. And I'll see you in one of my videos or in the next live lessons. Take care, everybody. Good luck and keep studying for OET. Bye from all of us at Specialist Language Courses. Take care. Bye.